At first glance, Paula seemed like the perfect patient. Calm, kind, cooperative. But as therapy unfolded, Ellert Nijenhuis quickly learned that her story was far from complex. In this video, Ellert reflects on meeting his first dissociative patient, highlighting the challenge of recognizing dissociation and the delicate balance that therapists must find when working with the different dissociative parts.
My very first patient, I've described her in part in The Trinity of Trauma, the third volume. I have named her Paula. Paula came to me after disappointing experiences with other therapies, various styles. She presents herself as a very sympathetic, very modest person. She's well-dressed, a pleasure to be with her. She tries to answer our questions, and on the one hand, I felt in interacting with her, wow, great, Paula's here, nice person, lovely to work with. And at the same time, perhaps more in the background, there was a kind of feeling, is this all there is to this person? Everything seems so smooth. And she doesn't seem to be very keen on discussing matters at a somewhat deeper level. Yes, she speaks about her life. She speaks about the fact that life in the family was not easy, but at the same time, she seems to cover it up. Not that I could easily say that she was covering things up, but that was somehow how it came across. Sometimes when we pose some questions that go a little deeper, she becomes, in an ever so friendly way, slightly defensive and switches the topic or says that she doesn't know, with a very kind smile accompanying her words. It was for me not so easy to assess her dissociative identity disorder. First of all, it was in the early 80s and I knew hardly anything about it. It was in part through patients such as Paula that I got to know the troubles, the disorder as such, and the troubles they engage in. But apart from that, the fact that therapy did not go forward very quickly also somehow related to her way of being in the world. It became slowly apparent that she overprotected her children. She had two boys and a girl, the girl being the youngest, and the boys, they turned teenagers and they became, of course, a little wilder. And her response to that was to restrain them as much as she could. And she was very disappointed that her boys escaped the house and did the things that teenagers do. She then tried to control her daughter, and I felt a degree of irritation. Yes, of course, I could understand her position, but at the same time, teenagers have to be teenagers. They have to grow toward independency. Sometimes her being neat was so neat that it was indeed also somewhat irritating. Nonetheless, we developed a rather good working alliance. And I slowly discovered the fact that indeed she had a dissociative identity disorder, even if I did not know it by that name at the time. And then she started to show hesitantly somewhat more troublesome issues, such as she cut herself. She was very ashamed to talk about it. I think she only showed me glimpses of it, but in the end, she did. And we got into touch with EP Fragile, several of them. And she was not too keen on relating with them, whereas my feeling was, wow, they are in need of support. They want to be recognized, acknowledged, seen, met. And Paula was rather absent in this regard. My urge was to push her. Come on. The younger ones, they need interactions with you, support, recognition, and all that. And at the same time, I felt the more I do that, the more I become a fragile EP, in the sense that I represent their longings more than perhaps A&P, Paula's longing to keep the little ones at bay. I realized, wait a minute, that might be a trap. I should not become part of the system. I must be, yes, in relationship with all the parts that make up the complete Paula, but I should not favor some more than others. But how to do that? Yes, I've expressed it. I liked Paula. And I didn't like it that she pushed the little ones in a corner where they had to take care of themselves. And I thought, if I'm going to pull at Paula to become more caretaking, then I have become part of the system. It might be better that I avoid ending up in that position and work with Paula as a whole person, meaning I relate to the fragile EPs and I relate to the ANP, and it is my job to help them start relating to each other more. Yes, I did interact with the little ones, but I tried to mind that interaction was not a goal in itself. That interaction might, apart from having positive influences on the little ones in the sense that they felt seen and met, I also was aware that I had to be probably a kind of model for Paula how to be a caretaker. Because it became ever more apparent as therapy progressed how strongly Paula had been emotionally neglected, maltreated, physically abused, and yes, also, as it felt, sexually abused. Sometimes she said a few things, and then in the next session, it was as if she never said it. When I referred to what she had said, she said, "No, I never said that." And I felt awkward. Oh, am I here suggesting sexual abuse where there is none? But it was clearly in my mind, even in my notes from the session, that she had talked about it. I thought, okay, I must not become the caretaker of the fragile EPs. Because if I do that, then Paula as A&P learns very little, basically nothing. And after all, it is her job to learn to take care of her little ones. They are also Paula. And the little ones have to learn that they cannot intrude on Paula as A&P full force. Because if they come Paula's way full force, with all the traumas that the fragile EPs carry, so to speak, then she will run. Thus the fragile ones must also learn something. So then I thought, okay, it is our job as therapists to relate to all dissociative agents that there may be and to treat them even-handedly. Easier said than done. Imagine there's a little one crying for help with that childish voice, the childish expression, the childish posture, speaking with difficulty about the fact that no one sees them, hears them, and at the same time, from the other side, A&P being very scared of the little ones. Basically, there were very lousy relationships between them. And this helped me realize that it was very important that my work should focus on helping A&P and fragile EP to start relating to each other. And that my work in talking to A&P and to the fragile EPs was in part modeling, showing how people can, in a meaningful way, effectively meaningful way, relate to one another. How there are boundaries in relationships, things that go and things that don't go. How I, as a therapist, for example, must be able, having spoken to a fragile EP, must be able to send her home, even if she wants to stay.
If you want to know what Ellert did in the therapy, please leave a comment and I can share with you the rest of the story. If you prefer reading, in Ellert's Trinity of Trauma in the 3rd volume, that is the blue book, you can read all about Paula and other patients Ellert has met and treated. If you prefer the online medium, we offer a full online comprehensive course that will help you gain a better understanding, gain new skills in treating dissociative patients, and we also offer online public masterclasses that anyone can join for a small fee. Just check out Ellert's website. In the next video, we will share with you what Ellert's understanding of healing a patient means, which may differ from other approaches.